Hello, welcome to Midwife Dave. This is a short video on hand expressing breast milk. It's a new technique and I think it's one of the best I have come across, so I thought I'd share it. It's going to take less than 4 minutes to show you how to hand express. Remember, hand expressing is really useful when you first had the baby. If your boobs are very full and the baby's not feeding very well and you just need to express a little bit off to give baby encouragement, maybe into a syringe or a cup. Or if baby's struggling, baby might be in skaboo and you've got to hand express the milk. And sometimes just before you've had the baby, if you want to harvest some colostrum, it's a way to do it as well. Remember, don't get stressed, be nice and relaxed, make sure you've had lots to drink. Okay, are you ready? Normally, we would use a knitted boob to demonstrate how to do this, but I don't have one today. So instead, I have got my melon. Let's measure this the right way around. Here we go. All right, so this is your boob. All right, and what I want you to look at is where your nipple is. Now, obviously, we'd love our nipples to be here like this, but naturally, they tend to be a little bit more like that or a little bit more like that. Whichever way, you're going to get one hand to hold on to and support your boob, okay, and the other hand is going to go just around the dark area of your nipple there, not right near the end, just to the edge there. And your thumb and your finger, and you're just going to squeeze like this. You don't need to squeeze down to the end of the nipple, you're literally just squeezing in. Now, if this was a knitted boob, then that would obviously go in. So you can squeeze there, right on the edge of that area. If that's not working, you can go a couple of centimetres up, so you're about 3 centimetres away from the edge. And if that, then you'll squeeze and release, squeeze and release, squeeze and release. If you're struggling there, come down a centimetre, squeeze and release, squeeze and release. And then you'll see that starts to work. You don't need to push back into your breast, okay? And you don't need to squeeze right down, so you're squeezing off the nipple. And this is all to help you do it in a comfortable way, all right? Just squeeze and release, and work your way around the boob. Squeeze and release, till you go all the way around and you've emptied those milk ducts, okay? And you've got all of the colostrum out or all of the milk. That's it. All right, so once again, you're gonna squeeze and release, squeeze and release. You might need to go a couple of centimetres back, 2 or 3 centimetres back, try it there. Squeeze, release, release. Keep going until you can get no more. And then you're gonna rotate around the boob. Now, at 3 centimetres, you might need to come forward a centimetre, squeeze and release, okay? It shouldn't be painful. You're not really gripping and squeezing, okay? All right, just a gentle squeeze and release. Now, I realise for some of you, this might be a really strange concept, and it's come to light that lots of ladies and lots of women have never really made friends with their boobs before. So, whilst you're pregnant, make friends with your boobs, okay? Some women, it's come to our attention, have never really touched their boobs. Now, you should be examining your breasts anyway to check for any lumps or anything weird. So, use the time in your pregnancy to get to make friends with your breasts, okay? Find out which way they go when you take your bra off, okay? Find out which way they're comfortable, all right? And try a little hand expressing just to get used to it before your baby arrives. And if you want to breastfeed, this is a great tip and a great way for you to get that milk out and reassure yourself that everything's working. And this video goes out to my friend Ella. Thank you for the fabulous hand expressing tips.